Kiana, and today I'll be doing a maternal assessment on a cesarean section postpartum patient. First, I will identify my patient. My patient's name is Beth Simmons. I will do that by asking the patient to state their name and date of birth and also check their armband. After I do that, I will then perform hand hygiene, provide patient privacy, and don gloves. And I'm putting on gloves today because I will be touching the patient's body. So what I'll be using to help me with my assessment is bubble heat, and the first B in bubble heat stands for breast. So that means I will check the breast size and any signs of engorgement. My patient is complaining of engorgement, so I will check the sizing and give some tips for that. So I'm checking my patient's breasts. They are a little swollen or big, and that could be because of any built up milk. Maybe she is not completely emptying her breast. My patient does bottle feed, she does not breastfeed, so it could be she is not completely emptying her breast when she pumps, and it could just be she is overproducing milk as well. So to help her with her engorgement, I could recommend some ice packs, or she can get her breast massaged or have a warm compress on there to help her. The next letter in bubble heat is U, and that stands for the uterus. So what I will do is palpate my patient's uterus, and I want to make sure that it is firm and beginning to move back into place. If it feels foggy for whatever reason, that could be an indication of hemorrhaging, which is something we do not want. After U is the second B, and that stands for bladder. And again, I'm gonna check my patient's bladder to make sure that it is not full, that it is placed where it needs to be as well, and to make sure my patient is not having any problems. My patient did complain of lower extremity pain and complained about it being worse with walking and ambulating, and that is normal. What we can do is administer medication to help with the pain, but it will get better with time. The next B stands for bowels, and I just want to make sure that she did have a bowel movement after delivery, and to check what other issues may be going on there. So Ms. Simmons, have you had a bowel movement since delivery, and do you feel like you are going regularly? My patient did have a bowel movement after delivery, and that is something that we want. So with lochia, you want to check the color, amount, consistency, and odor. Some bleeding is normal after vaginal birth and cesarean birth, but we just want to make sure that it is not a dark color, or that it's not profuse blood, because then that would indicate that there is a problem, or something that is not healing properly. So after that, you want to check the E, which is the episiotomy location, and want to check for any edema or any improper healing. So that would just be the surgical site location. So that would probably be up here somewhere. And I would just want to check to make sure that it's properly stitched, that there's no tears in the stitching, just like I would if I were to be checking a wound. And I want to make sure that there's no swelling, that it's not hot to the touch, or that it is just uncomfortable for my patient, or doing something, looking a way that it shouldn't be for the patient. So the H stands for Holman sign, and with that, I would determine if it's positive or negative. If it is positive, then that can be an indicator of a DVT. And if my patient has a DVT, she could complain of calf muscle pain, or just some tightness there, and that we don't want the blood clot to move. So I would have her position in like her leg in a 90-degree angle and check the area. I would not massage it because I don't want the chance of moving the clot somewhere else, but we would take necessary nursing precautions to alleviate the problem of the DVT. And last, the E stands for emotional bonding, and just psychological approach, I would want to make sure that my patient is bonding with her newborn, if they're smiling, if she is eager to hold and touch her baby, if she's reacting well, if she has not held her baby for a few hours since delivery, or if she is just standoffish, not wanting to feed, or just embrace her baby, then that would be like a negative reaction to this child, and then I would look further into that. But the outcome that I would be looking for is just a positive mother newborn relationship and bonding. And that completes my OB assessment.